Hi, it's your psycho buddy. If you're dealing with something really challenging and you're looking for a mental health professional or someone to help you get over the challenging thing, you've got a lot of options. So I want to clarify what the different choices are and what people are called. So psychiatrist, nurse practitioner, those are the two medical ones. And then psychologist, therapist, and counselor are the ones who do talk therapy. And then a coach is the least formal category, and they deal with life challenges that are typically not mental illness. They're more high functioning. Let's go to the top two that often get confused by people who are new to the field, and they are psychiatrist and psychologist. Both of them are doctors. The psychiatrist is an MD, so a physician with medical training who specialized in the science of the brain and the mind, because the brain is a neurologist, which is another medical specialization that can help with mental illnesses or brain disorders. Whereas a psychologist either has a PhD, a doctorate of philosophy, or a PsyD, a doctorate of psychology. Psychologists can provide therapy, and they often do research outside of therapy. They deal with the most intense of mental disorders, typically psychosis or severe psychopathology, that kind of thing. And they have an extensive academic background in theory and stuff they teach in grad school. Therapists come in lots of flavors and have master's degrees. Counselors are licensed, like an LPC, a licensed professional counselor. Oftentimes the word therapist is used to refer to any one of those three: psychologist, therapist, or counselor, because they provide versions of therapy. Whereas, as I said before, a coach is someone that you might want to contact if you're looking at a specific accomplishment and you need help around it, or if you want to improve your life in some way and you're already fairly high functioning. Coaches, I believe, are usually not covered by insurance, and they come in lots of different flavors. So an internet search will let you know what's in your area, what kind of expertise in coaching. Executive coaching is the one I'm most familiar with. So there you have it. Psychiatrists prescribe medication. Psychologists are very highly educated and specialize in intense mental health disorders. Therapists have typically got a lot of experience in order to get their master's degrees. They involve practica, or internships where they get a lot of time in with clients. So the place to start is a mental health center. If you are on Medicaid or otherwise can't afford private practice, then you can go to a community mental health center and they'll do an extensive intake and sign you up for a visit with a psychiatrist and a supportive counselor, and then eventually with a therapist. And then you have those two together, therapy and psychiatry. In my experience and in the research that I've read, it's highly recommended to have therapy if you're taking medication. So, and the reason is that medication doesn't fix you. It's like stopping using drugs. Once you get abstinent, that's just the foundation for healing. Medications are just the foundation for changing your life in a way that'll last. So they do make life easier to navigate, but they're not a permanent solution. They don't address the problem. That's what I'm saying. They don't address the core of the issue. They only address symptomology. So if you are on medication working with a psychiatrist, you definitely want to be working with a therapist as well so that you can address behaviors to create long-lasting life change. Good luck.